My name is Jacob Brayboy. I'm a family medicine doctor. I'm board certified in family medicine and a member of the American Academy of Family Physicians. I did my medical school at Brody School of Medicine in Greenville, North Carolina, and did my residency at Pitt County Memorial Hospital in Greenville, North Carolina. Upon completing my residency, I moved to Chicago to be closer to my wife and spent 7 years practicing medicine in underserved areas of South Side Chicago. I'm from North Carolina originally, and the Triangle is a great area to be in. It's close proximity to the mountains and the coast, but also just to be closer to friends and family here. When I was in college, I suffered a spontaneous pneumothorax, which is basically a collapsed lung, and I was in the hospital for over a week, and it was a very challenging time, but I do remember a doctor coming in and just spending a little extra time with me during my time in the hospital, and that made a big impact on me. There were a lot of doctors going in and out of the office or into the room with me, and they barely looked at me and just looked at me more as a case rather than a person. But that one doctor really looked at me in the eyes and told me I was going to be okay, and that made a big difference and a big impact on me becoming a doctor and wanting to relay that to my patients as well. Yeah, I chose family medicine because of the variety. You've got young patients, you've got old patients, you've got acute medical conditions that you can focus on, as well as the preventive health care. That's extremely important to preventing disease in the first place. My main interest in medicine do involve is preventive health care, whether it's mammograms for women or colon cancer screening for men and women, immunizations. These are all things I'm passionate about, following blood pressure, hypertension, high cholesterol issues. Diabetes is a big issue, as well as obesity in the United States. So being able to focus on those issues to really help make a difference in the patients' lives. Yeah, my main interests include being able to spend time with my wife and our son. We have a dog also, her name is Stella. Being able to spend time with them, whether it's traveling or just exploring our neighborhood. I also enjoy cooking. I make a pretty good red sauce for pasta. Playing guitar is a passion of mine, namely really fast punk rock kind of music is a lot of fun as well. I chose Avance Care because of the teamwork mentality. When I was speaking with whether it was the nurse manager or whether it's the CEO, all the way to my co-workers, the nurses, other physicians, nurse practitioners, there was this teamwork mentality. And when you work as a team, you provide better care, more compassionate care, and better outcomes ultimately for the patient's health.